subscribe and join the HOHO family.
Hi everyone, it's Happy Tuesday. So I just wanted to give you guys some updates from the last vlog where it ended with me waiting for the doctor to call me on Monday, which is yesterday, to assess if I'm ready for work. So it turns out that I have been having intermittent fever with some bout of coughing, stuffy nose. I was generally feeling a bit unwell throughout the weekend. So when the doctor called me, unfortunately I was deemed not ready for work at this point, and I had to return to the emergency department the next day, which is today. So this morning, John sent me back to the emergency department to meet up with the doctor to discuss our plan of action. So we're off to see the doctor at the ED. Hubby John here is helping to send me because I'm not allowed to take public transport for now. I have to wear a mask when I get out. So I'll update you guys what the doctor has to say after examining me. It's been really quite long on 10 February when my temperature rose and when I went to the emergency department. So it's been like a week already. I went over and I met up, and this time I was actually brought to the fever facility, not the isolation facility. Based on my observation, the fever facility seems to be the first point. Say they deem that you are at a higher risk and you need to be isolated, you will get sent to the isolation facility where I was last week. I've noticed a patient who actually declared her travel history, and because she was also feeling breathless, so she was then taken from the fever facility to the isolation facility. So today, because I actually am not having a fever already, I'm actually just brought to the fever facility just to meet up with the doctor who I met last week. So the nurse just took my BP and they took my temperature. I'm just waiting for the doctor to come here. He examined me and my lungs were still clear. So he was also quite puzzled why why I actually took so long to recover. And he decided to do a blood test to check to see if things are normal. I just had to wait for the blood test to be out, the results to be out, and then he will discuss with me further. I was just waiting and waiting and waiting a lot. Like most of the time I was just using my phone. I was a little bit anxious because I want to go back to work. I'm actually still on probation. So currently, as of now, I know that my probation has been extended because of my hospitalization leave. My colleagues are actually very understanding, they're very supportive. It's just that unfortunately, because I have been away for an extended period of time, so my probation period has to be extended. I know that it's not their fault. It's a given, it's understandable that my probation has to be extended, but I was really anxious because I don't know it will be extended for how long. So I was also explaining to the doctor like my situation, and I was hoping to get his understanding, his assessment that when would be a good time for me to return to work. However, as it is the protocol that if we are unwell, especially with upper respiratory symptoms, we are not allowed to return to work. This is in line with MOH's new protocol, which is for all Singaporeans, for anyone, not even Singapore, anyone who has upper respiratory symptoms, you have to see a doctor, and the doctor will give you 5 days MC. You have to stay at home. After 5 days, if you are not well, you have to go back to the same doctor. Thereafter, the doctor will assess and see if you require more tests. This is put in place to make sure that there is a reduction in risk of transmission, because studies have shown that they have observed that most of the Singaporeans who got the virus, the COVID-19 disease, they actually still went to work, they still went to do their things because they thought it was just a mild symptoms, flu symptoms, and they went on and they might actually infect others. So back to the emergency department, I was waiting and I was told like it would take about an hour-ish for the blood test results to be out, and I waited for almost about 2 hours. The doctor then came in and he apologized to say that they've lost my blood sample. They don't know where is it. The doctor sent it out but it didn't reach the laboratory. So he apologized a few times, and initially I was pretty upset inside because I waited pretty long and I was hungry. I didn't have anything to eat, so I wanted to just go back as soon as possible to rest as well. The thought of restarting everything to wait again really annoyed me inside, but at the same time I looked at him and this doctor looked really very busy. He was apologetic, it was not his fault. So I ended up being very empathetic, and I just say, you know, like, okay, you can just like redo it. I requested for to go out and have lunch, but he told me that I'm supposed to stay in the fever facility. It was pretty nice of him. He actually got the nurse to grab me a snack, which was like a cookie, a pack of cookies, as well as 100 plus. It then dawned on me that, you know, they are so busy, they might not even have the time to actually grab a bite themselves. In view of that, I just felt like at this point in time, you just can't blame anyone. Just get it over and done with. So I just consented to redoing the blood works, and the doctor said he would send it to the lab and he would definitely monitor for the results to be out and let me know as soon as possible. And the doctor came to me as soon as possible. It was like not even 1 hour, and he told me that the results were good. Things were normal. However, he still gave me like steroids for the inflammation, because I think there's still some inflammation, and also 2 bottles of cough syrup and also some medicine for phlegm, because the dry cough has also turned into productive cough. It's just like intermittent also. It's pretty weird. I have no idea what is going on actually. But yeah, so he told me to take that, and he actually extended my hospitalization leave because I'm still not well. Because it's been some time, I also asked what happens if I'm still not better by Thursday. He's supposed to call me on Thursday to assess if I can return to work on Friday. I requested to return to work as soon as possible in view of my current situation. If not, he actually told me to go back to work next week. Doctor's next plan of action is for me to see a specialist for my upper respiratory symptoms if I am not well by Thursday. I think he highly suspects that it's asthma. This was what the 2 GPs suspected as well. But I really don't think I have asthma. I'm able to recover. I don't think it's even though I feel breathless sometimes, I'm able to recover, so I don't really think it's asthma, but we shall see. So far, my thoughts about the whole healthcare measures being put in place, I think the government is doing really well. Even when I witness my hospital that I work at, also they know their protocol very well. Measures have been put in place, the staff are experienced, they know what to do. Amongst the chaos, there's actually structure, so everyone is just doing their thing. So I really put my hands up to those out there who have been slogging their guts out just to make sure that we are safe, treating us when we are sick, even though it means putting themselves out there at risk of getting the virus. It also warms my heart to see that many companies are also supportive of the healthcare professionals. There have been many food deals out there given to healthcare professionals. There are volunteers who are willing to send food to the hospitals so that the healthcare professionals can eat during their busy time. So at times like this, even though there's a lot of negativity and there are a lot of people who are criticizing this, criticizing that, there are panic buyers, but there are also a lot of compassion and love. So we just need to be balanced and we need to see both sides of the coin. I'll update you guys again on my situation. I hope that my next update would be that I'm able to head back to work. I really hope so, but I'll keep you guys updated. Goodbye!